Hi, I'd like to talk about what it's like to have an initial session here at Louis Laves-Webb. So first of all, we're sensitive to the fact that when you're reaching out, most of the time it's not because everything's going perfectly. So we want to acknowledge that and want to be sensitive to that as we start out. Additionally, basically, you're going to be educating us. So we're going to ask you questions about, what some of the concerns are and what's going on currently. But we also want to get to know you just a little bit more broadly overall. So we may ask about previous experience with mental health, about work, about relationships, family, children, hobbies, interest, hopes, things like that. Just trying to get a best sense of you as we can. And that'll take up the majority of the time in our first session. If there's anything we ask during that time that you don't feel comfortable answering, don't. Our job's to get where you are, not necessarily for you to get where we are. And we'll just take it one step at a time and kind of check in with you throughout the process. And then toward the end of the session, therapists, we tend to hear things a little bit differently than the average person. So we'll give you a sense of how we're hearing some of the things you're saying. So that may include areas that seem really relevant, really important, kind of worth understanding more deeply. Or it may include things that seem connected. My dog passed away 5 years ago. Since then, I've been depressed. So it's not a hard and fast assessment, but at least a chance for you to have something semi-tangible as you're leaving the first session. So please fill out the contact form, and if you have any other questions about the initial consultation or the initial session, feel free to ask one of the therapists that you're seeing. All right, thank you.